Welcome, and thank you for joining us. We're here today with Dr. Bud Hammes and Linda Briggs, Director and Associate Director for Respecting Choices. And we're here to sit down and learn a little bit more today about what teams and organizations and communities can be aware of as they prepare for National Healthcare Decisions Day on April 16th. So with that, I'd like to introduce you to Dr. Bud Hammes and Linda Briggs. And I guess we can just step into this right away and ask the first question. What are some of the positives about a day like National Healthcare Decisions Day? And we'll start with you, Linda.
I think it's always good to remind us all that we have the right to think ahead about what choices we would make, what healthcare choices we would make if something were to happen to us and we couldn't make our own healthcare decisions. We've had that right since 1991 after the Patient Self-Determination Act, but we all know that a lot of Americans have not taken that step to talk to their loved ones and to think about what choices they might make for themselves. So this is a day to bring that to everyone's awareness and to allow them to think about, maybe I should do this work for myself. Where would I go to get resources, and who would I talk to if I wanted to take that move? And we certainly would encourage everyone to do that. So it's a great opportunity, I think, to remind everyone again that we do have that right, and what are the local resources that are available.
Sure. Dr. Hammes?
Well, I agree with Linda that I think that's one of the important things. I think the other really important aspect of this is that by making it a national day, it starts to open up a more community conversation. And by that I mean is that by the fact that it's on the news media, it's being publicized, I can say to my spouse, to my children, to my parents, did you hear about that? It's something important. I'd like to talk with you about it. Mm-hmm. And by making it a more public, communal kind of event, I think it starts to break down some of the social and other barriers for families and neighbors and relatives to have these important conversations. I think the literature is extremely clear that simply getting individuals to fill out kind of in a technical way legal documents does not lead to the results that we want, which is the actual respecting of people's preferences and choices at a time they can't make their own decisions. And so I think the fact that this is a public day, this is a national day, has the potential of breaking down some of those communication and discussion barriers, which I think is extremely important.
Kind of like we're in this together.
Right.
And I think that's right, but I think at Respecting Choices, when we work with teams and communities, we really encourage them to think about that awareness concept, developing strategies and activities to keep the awareness in front of people all year long, rather than just focus on a couple of events every year, to try and think about moving the concept of advanced care planning into people's homes. It's a part of routine health care for every individual. Certainly, if we get sicker, the choices that we need to make tend to be more complex and we need more additional help. So I think we would encourage the folks who are looking at National Healthcare Decisions Day to think about how to carry on that awareness and keep it in front of people.